Cool. Who are you and what do you do?
Yeah, well, thanks for this opportunity. So I'm Leo Chen. I'm a psychiatrist and a researcher, and I'm a associate professor of psychiatry at the University of Melbourne, and I'm also the psychiatry research lead for St Vincent's Hospital, Melbourne.
Wow, that's a long title. It's a long multi-part title.
Well, the institutions have long names.
Yeah, it sounds like really interesting work. And does your work have any focus areas or focus populations?
Yeah, so I foster and I build research capacity at the university and at the hospital, but my own research program focuses on brain stimulation treatments and deriving sort of cutting edge neuroscience to do brain stimulation better. And the type of brain stimulation I do is a treatment called transcranial magnetic stimulation. So it uses electromagnetic energy to stimulate the brain. Yeah. And the benefit of that is that it's non-invasive, it doesn't involve drugs, it's very well tolerated. Me and a very hard-working team are working on doing it better so we can help more folks.
Yeah, that's incredible. And that's known as TMS, isn't it?
Mm-hmm.
I think. Maybe some other people might know it by that name. And who makes a good candidate for TMS? Is it specific conditions? Or?
So in Australia, TMS is an approved treatment for depression, particularly depression that hasn't benefited from existing psychological therapies, lifestyle interventions, medication therapies like antidepressant medications. But overseas, it's also commonly used for other psychiatric conditions like OCD, like depression for older adults, and other non-psychiatric conditions like neuropathic pain, fibromyalgia, motor rehab after having had a stroke. Yeah. So, I mean, these are all brain conditions. So that's the common denominator, and the common hope is that by, directly modulating brain activity, we can change outcomes in whether they're thinking problems or behavioral problems or motor problems.
Yeah, which are all brain
problems.
Things. Yeah, gosh, that's so interesting. I guess with everything being brain-centered, where do you see challenges with things like capacity building or executive function in the people you work with in the research projects?
I think it's about patience on both the users' part, but also on their supporters and their clinicians' parts, because it takes a bit of time to work out which strategy or tools work best for you, and then you've got to, so it takes a bit of time to try a different strategy on for size. And then once you go, okay, so this works for me, like carrying a notebook or having a personal reminder or whatever it is, whatever works for me, then to get into the habit of using it and engaging with it. And sometimes people might lose a bit of patience in that process, or their carers, their families might not sort of give them the time to get used to, adopting that aid, or even clinicians, they busy sort of working in hospitals or clinics and things like that, and just giving patients the time to sort of do what they need to do so that they can be, maximized in terms of their functional, executive, cognitive capacities when they're engaging.
Yeah, and I like what you just touched on there about, like, essentially it is a long road for whatever interventions or lifestyle changes. Everything does take time.
And reps, and lots of reps.
Lots of reps, yeah. Some pop psychology books I've come across say 90 days is what it takes to form a habit. Does that align with?
That sounds about right.
Deeper research?
Yeah, I think that sounds about right. I've heard as low as 3 weeks. Like a daily implementation, but I think 3 months sounds about right, or somewhere in between there.
Yeah, interesting. And I'll loop back to treatment-resistant depression being the main use case for the technology you're with at the moment. What are the main challenges, the main sort of like day-to-day life challenges you see with people living with that?
Oh, everything. So, our mood is kind of like the metabolic drive for the brain, if you'd like. So if you sort of slow down the metabolic drive for the brain, everything becomes harder.
I've never thought about it like that.
Yeah.
That's such a good analogy.
Yeah. So, the patients will talk about how they feel like they're running on empty. There's no energy to do things quickly. They can't think quickly. They can't react quickly. Things that will usually take them half an hour to do, let's say do the laundry or the dishes or something, 15 minutes. But, when they get depressed, it takes them twice as long, 3 times as long, to read a chapter in a book.
Yeah, and it sounds like it's not just the duration of the task, but maybe even the heavy lifting of planning the tasks, of how long will it take, what's the next thing.
Yeah, and the concentration, the attention falters while they're doing the task, and they're already not feeling good about themselves. It might be sort of self-defeatist thoughts or hopeless thoughts, or thoughts of being worthless, or just in general sort of negative thoughts. So being constantly distracted by those, sort of is a bit of a, throwing kind of fuel on the fire kind of situation.
Yeah, and it's a really challenging situation, I guess, knowing that those basic daily life things, like having a good habit of, I'm not sure, brushing your teeth or getting a good night's rest, or we know that they're building blocks for well-being, but when they're just so hard to do, and so hard to keep up with, it's very tricky. What would be your feedback or thoughts on something like Pebbl, not as a replacement for or a medical intervention in any way, but as another tool in the toolkit for people trying to keep up with life?
Yeah, I think it's great. I love that it's wearable, it's smaller than a phone. And it's, obviously sort of designed in a way that makes it attractive to use. Yeah, I think it's great.
This is a little off script, but I would love to get your take. One of the big decisions with designing Pebbl was that it has no conversational AI in it. You do talk to it to set reminders, and it talks back to give you information. But I can't have a conversation with Pebbl about my favorite topic, or we can't kind of fall into that friendship space. And I'd love your perspective on that from a psychiatry or mental health perspective. We're seeing so many new technologies that are playing the role of friend, or the role of therapist, or even the role of romantic interest. And for Pebbl, I very intentionally went, we're not playing in that space. That's not what Pebbl is. But have you seen kind of a surge of that starting to come up through your work, of how these AI technologies interact with people's mental health?
Not me personally, but it's something that I have heard about. Yeah, and it can be both positive and negative. But I think the risk that I've fairly sort of consistently come across has been when, the AI model has been trained to be affirming, and sort of leads people down a dark path.
A literal dark path.
Yeah, a literal dark path. When the AI sort of model has been trained such that it's supposed to be affirming, and it might lose a bit of the kind of objectivity or the balance and the challenging
safety nets of what it is that it's affirming.
Yeah, for folks.
Yeah, that's a really interesting insight. It's from my perspective, it's like a watch this space, because there are so many things like that emerging, and like regulatory safety nets are going to take time to catch up. So it makes me nervous. Going back to, I guess, the core of this conversation, what are some gaps that you see in current supports for people that you work with, whether that's treatment-resistant depression or other conditions?
The efficacy of our treatments can be improved. I think the access to sort of like a prompt response to psychological distress can be improved, and that's the hard one to address, I have to say. There are only so many call centers you can staff, but when people are in distress, they don't, sometimes, not all, but sometimes they don't necessarily want to speak to a call center. They want to speak to someone they know, someone who knows their story, who knows their background. But then at the same time, it's hard to expect that person to be, on call 24/7. So I'm not quite sure what's the resolution to that one, but maybe, something that I find myself reflecting on is that with psychological distress or mental poor health, people who experience it, they generally are experiencing quite high distress and they want fast relief. And I think that's one of the trickier parts of working in this space. I'm very passionate about it. My colleagues and I are all very passionate about it. We all want to do better in this space, but, to be able to, offer sort of prompt, effective relief is easier said than done. So I think that's one of the barriers.
And like we touched on before, I'm hearing what you're saying about, being there when people need. But then it's also such a long road. So that craving of a quick solution isn't always going to be possible.
And also that, difficult lived experiences or mental health challenges, as I said before, when people experience them, they want something done about it right now because it's so distressing. Whereas a lot of physical health symptoms, don't get me wrong, there are a lot of acute physical health symptoms as well, chest pain, like a heart attack. That's unbearable, right? But for a lot of other physical health symptoms, a cough or breathlessness or a very sore knee, and if you called up a hospital or you went to see a GP or if you go see a surgeon and they say, we'll see you in 2 weeks' time or 3 days' time or 2 months' time, it's, you're not happy about it, but you're okay to sit with it.
You've got that mindset of, I think maybe because it's things that you can feel and you can see, this is going to take time to repair. It's easier to have a tangible mindset.
But say with mental health challenges, if you're experiencing acute anxiety, if you're experiencing acute paranoia, if you're, experiencing a panic attack, it's urgent. You can't wait 2 months.
Yes. These are all such excellent points. I'm just trying to think about where we go from here because this has opened so many doors in my brain. I'm not sure that you work with many folks that are neurodivergent or cognitively complex. Another population I'm hoping Pebbl is useful for is folks with dementia or memory loss.
I think it can be very useful for that.
Well, I hope so. Does TMS treatment have any residual memory loss associated?
No.
That's
if anything, some people, as I said earlier on, in Australia, the main indication is for treating depression, and for people who get better, their depression gets better with this treatment. We see some people, their memory and their cognition response speed, executive functioning actually improve. Because that sort of those cognitive symptoms are part of the depression. And if you can get the depression better, those symptoms also get better.
And this is why I keep reiterating that Pebbl is not specific. Just because I'm autistic and ADHD does not mean that's solely who this is for. It's our executive functioning abilities touch on so many different experiences, from really acute psychiatric experiences right through to people that are just busy. We've all got so much cognitive demand on us in this world. Going back to your research projects, how do you collect data on if your treatment is working, if someone is getting better?
So the traditional paradigm is you design a project, you determine which outcome measures to use to evaluate efficacy, and you would plan to do those outcome measures at the beginning, or what we call baseline, and then over the course of treatment and until the end. So let's say you design a trial and the intervention goes for 1 week, 2 weeks, 4 weeks, whatever it might be, and you determine in your mind that you'll measure those outcome measures from baseline to week 1, 2, 3, 4, let's say. And the primary endpoint is at week 4. So then you see, over the number of research participants who have received your treatment, to see how much change.
And you get some nice standardized data points that you can map.
And then you can see, how much change there's been in the outcome measures.
And so those captures are usually a static survey or static interview at those different times.
We call them rating scales. So, often they're sort of 10 to 30 questions.
I'm curious to get your thoughts on the way that something like Pebbl could capture more real-time data in relation to getting feedback on someone's progress. So, for example, all of the reminders that Pebbl is setting as you're completing them throughout the day, you're getting little timestamps, you're getting little summaries of the day. Today, you drank 2 glasses of water and you went for a walk.
Yeah, definitely. So, if there are, we're talking in the research setting, right? So if there are research trials that involve people taking medications, it will be very handy for the research participant to say, I just took my tablet, and it'll log a time, and it's 35 hours or whatever it is. So, might also be reminders to take their medications.
So it's sort of both. It's supporting the accuracy of what steps need to be done, and then getting more real-time information about what happens when, and even collecting symptom or experience feedback.
As a sort of a wearable symptom diary. So if you're measuring...
it's lunchtime, how are you feeling on a scale of 1 to 10? How's your appetite right now? But, the possibilities are kind of endless. And that's not the primary purpose of Pebbl, but it's something that seems to be coming up in discussion with academics. So it's an interesting path. Another analogy that I have been reflecting on is going into a GP's office, and if you're getting questions related to your menstrual cycle, being able to jump into a period tracking app, and you've got that historical data that you can simply show to a GP really quickly. And whether the data that Pebbl captures about your daily routines, habits, being able to really easily share that with your care team.
And particularly if you can sort of have Pebbl integrate with a period tracking app, have Pebbl integrate with a blood sugar tracking app.
There's some really interesting possibilities, and maybe in a year's time we can explore where we're up to. What is your hope for the future of mental health and mental health research?
So look, I'm a researcher and a sort of a neuroscience informed researcher, particularly looking at developing new treatments or improving our existing treatments, right? So I'll respond from that angle. I think if we can invest more in researching and developing innovative, effective, well-tolerated treatments, and across the board sort of reducing the burden of mental illness, I think that would be a real game changer. And then, along the way, as you know, in science, there's no such thing as low-hanging fruit. Every effective treatment probably came with 10,000 failed experiments before them.
Very iterative.
But every time we do that, we are learning. We're learning about, how the brain works and how the brain interacts with the environment, and
very exciting. And you touched on this earlier, but sort of the holistic landscape of mental health. Do you have any hopes for the future, maybe around community perception or stigma for mental health?
I think as a nation, like in Australia, I think we're doing pretty well in destigmatizing mental health. I think now it's about better understanding common symptoms, conditions, and their best models of care, and developing more effective treatments for them.
I agree that Australia has come a long way, and we've still got a long way to go, but I feel that we're on the right track, which is really exciting. All that being said, what should I do next for the Pebbl project?
Again, I'm a researcher, so I'll take a pretty traditional put a pretty traditional sort of research translational framework around it. I think once your prototype is ready to be sort of produced in more iterations, and it's gone through all the beta testing and things like that, to evaluate its effectiveness in a clinical trial, so a trial in clinical populations.
Yeah.
I mean, you can do it in a healthy populations first, just to make sure that it's feasible, the device works, the communication, functionally in the background, it's all logging everything. And then, to evaluate whether it's of benefit to folks who have, who could benefit from sort of cognitive and executive reminders.
And I think it's going to be really interesting starting to collate the data from a really broad population of, define healthy, but a really broad population of folks that are a mix of people working really highly stressful jobs and other people with serious cognitive and mental health challenges, and then looking at that subset, but then the subset again of the supportiveness of something like this for dementia versus autism versus ADHD, and really starting to unpack what helps who and how can we broaden that toolkit of wrap around clinical stuff, community stuff, and all the other tools that come along the way. It's
and increasingly we are doing, and we are maybe I'll put it this way, and increasingly we are designing clinical trials with the end user in mind, often right from the beginning at the design stage. This sort of process called co-design. So co-designing a research protocol that has collaborative, consumer input right from the get-go, so we can know that what we're evaluating, how I talked about the outcome measures and things like that, they're actually relevant to people, and that the trials are, not too onerous, but also sufficiently robust that we're getting good, usable evaluation data, etc., etc. So, I think, for the Pebbl project to do a trial where, the evaluation was designed with lived experience would be really
and
powerful.
co-design is the heart of this. I do a lot of co-design work at my job at Royal Melbourne and just within my community. And as a designer as well, it just makes sense to me. If we're going to start with a problem space, we start with the people that are affected and we build alongside those people as we go. This has been great. Do you have any final remarks or ideas? No,
this is really novel, really cool. It's really invigorating for me to see sort of like these innovations, come to life. I mean, you're wearing a real one there. So, all the best to you.
Thank you.